hospital. My interests have been liver disease. I've been the trust alcohol lead. We've set up our alcohol care team. Being one of the most deprived parts, we have very high sort of um, demand, and we needed to set up a sort of slick service to address the patient needs. So I do have some experience of dealing with alcoholic liver disease and alcohol dependence. I play badminton with Alosh, and he asked me, "Can you do this?" So thank you. I've just been speaking to some doctors doing a presentation at lunchtime, so it makes a nice change to present to not necessarily completely medical group. I see few doctors and few nurses and pharmacists in the group, but hopefully there'll be a good number of lay people as well. At any point, please do stop me if I'm not clear, if anything needs clarification, or if you feel I'm speaking rubbish, just let me know. I would like this to be as interactive as possible. So there's no such thing as a silly question. Please ask away. I'm not sure if with the technology glitch, am I supposed to share the presentation, or is Aloysius doing it?
It would be great if you could share the presentation. I can share it if that doesn't work. Yeah.
Okay. Just give me a moment. Share screen. Window.
Perfect. We can see it now.
Start from the beginning. How do I start from the beginning? I think
if you could put it on F5 or the presentation mode, then it should start from the beginning. Or slideshow.
Slideshow. It won't let me, Alosh.
Should I try to share my screen from my end? Because
yes, please. Yeah, share. Stop. There's only one slide which I've added since I've sent it to you.
That's all right. I can share it from my end.
Yeah, thank you. Stop sharing. Can I ask you what this platform is? Is Google platform, is it?
Yes, Google Meet, yes.
Google, okay.
We've been using, in the past we've used Microsoft Teams, but then we use Google because it was easier for people to join from their phones.
Yes, yeah. Because I'm used to MS Teams, so shows my ignorance trying to share this.
Let me share my screen. Okay. Can you see my screen?
Yeah, thank you.
I'll go from the start. Yeah, please let me know when you need to change it as well.
We can see.
Yeah, we can see. So thank you very much. So putting it in context, this is a global burden of disease. If you're ever curious and if you got some spare time to look at the global burden of disease, just put in Google search global burden of disease studies. And it's a wealth of data about each disease, each risk factor, for example, alcohol. So I picked the effects of alcohol in here. So this is the weighted relative risk of it's in DALYs, that is disability adjusted life years lost. So for example, they've been unwell, they lose 1 year, that's 1 DALY. Or early death, they lose so many DALYs, calculated years. So as you can clearly see, as the amount of alcohol increases, the life years lost goes up fairly dramatically.
Mm.
Um, Next slide, please. But this is a Lancet study which came out in the UK a few years ago, which and then post-COVID, which raised alarms about the increasing numbers related to alcohol liver disease. Um, if you looked at acute causes, they're grumbling along at the baseline, that is alcohol intoxication, delirium. But the liver disease, the red line in the first number A, you can see it's steadily going up, and post-COVID, it's taken off significantly. And in terms of the age it affects, it seems to be from 50 to 70. That's the highest two peaks. Affects men more than women. Next slide, please. This is a very busy slide. I don't want you to take much out of this, but just a couple of things. This is, again, global burden of disease. Globally, what is the most significant disease burden? And as you can see, worldwide, it's neonatal disorders, um, diarrhea way back, but now it's more ischemic heart disease has taken over. So as we are getting more and more affluent, this is the disease of affluence, isn't it? And the two things I wanted to point out is diabetes, which was way down as the number 20 or number 20. Now it's gone up to number 5. Alcoholic liver disease or chronic liver disease related to alcohol was way up, but it's gradually gone down. So they're both reversed. Next slide, please. And how does alcohol affect your liver? So alcohol is sort of has its effects because of the intermediate metabolite. Alcohol dehydrogenase breaks it down to acetaldehyde, and that is the toxic one. And it's almost like a free radical, causes inflammation and scarring. And it also interferes with the fat being broken down. So fat gets deposited in the liver by blocking an enzyme called PPAR. So you get fatty liver, liver cells get ballooned up with fat.
Mm.
And with ongoing insult or injury, you get scarring because of the free radicals. And alcohol is not just broken down in the liver, it's broken down in other parts, and it does cause other organ damage as well. The fatty liver is completely reversible, and it depends on the amount of alcohol they're drinking. It also depends on other cofactors. For example, diabetes is one of the biggest factors of causing fatty liver now. And if on top of diabetes, there's alcohol intake or alcohol excess, it almost multiplies the risk, not just doubles. So, and then some people develop what's known as alcoholic hepatitis, where with prolonged drinking, they develop deep jaundice and they decompensate. And at this stage, most of them have a degree of scarring. And if they stop drinking, some of them do get back to normal. But significant majority go on to develop cirrhosis with ongoing alcohol intake. So this is taken from the British Liver Trust. And as you can see, cirrhosis is basically end-stage scarring of the liver. So as the more and more scarring forms, you get the liver tissue into small nodules, and it becomes very nodular liver. Within the scarring of the liver, there is liver tissue, which can still work, especially if they stop drinking. The way it works improves, and majority will what we call compensate. So they can lead a reasonable life without any decompensation. there is good evidence to say some people do reverse this with abstinence, with addressing the other risk factors, which is diabetes and weight loss. The whole idea is picking them up early, who is at risk. How do we do that? And I had put in another slide, but I'll discuss about it later. And next slide, please. So these are the factors that increase the risk of developing this liver disease, especially the steatosis, so the fatty liver and the scarring. A weight in the overweight or obese range, having type 2 diabetes, they're both linked again, once again. And women seem to be more vulnerable to the alcohol effects than men. And any other prior liver conditions such as hepatitis C and hemochromatosis increases the risk. And there is a strong genetic component. It's not the same, because you can see some people who drink so much, but they don't seem to develop any liver disease. But some people who may just drink just over the recommended limits and still end up with significant liver disease. So there is a strong genetic component. We don't know what exactly it is. Okay. Next slide, please. I've included this slide. Okay. This is how we screen our people and patients who present to A&E. If we feel they're at risk, we ask them, would you be willing to see if whatever you're drinking is harmful? So this is a well-validated WHO questionnaire called Audit C. Okay. And it basically goes through some simple questions. How often do you drink? How many drinks? And how often have you had more than so many drinks in the past year? So, quick pause. I don't want you to get your scores, but just have a think about it and just calculate your own scores. And to be fair, when I came across this questionnaire, I had to really think, oh, I go into this binge drinking range. I'm really drinking to the excess. That was about 20 years ago. So it just raises the awareness. The score above 5 is considered harmful drinking. It doesn't take much to add up to 5. And this is available on any search engine. If you just say calculate audit C, it will give you the online questionnaire, and it will also tell you what the risk is once it calculates the score. Once we do that, usually we complete the full audit questionnaire. If they are at risk, we identify the risk and ask the patients, do you want to complete the full questionnaire? It will give them better insight. And once they do, and they're considered at risk of developing liver disease, we explain to them about the safe limits, and we also do what we call brief advice and brief intervention. And these are trained nurses who do this. And at Gateshead, when we first started the alcohol care team and first started this, we identified, I think, 800 patients a year. And it is difficult to show the change afterwards, but we've identified 800 at risk, and we've managed to intervene in majority of these. And that work continues even now. And it's been so well received that we were identified as a good example at the national meetings, and then the number of liver nurses, alcohol nurses that we employ has increased to cope with the increasing demand. So it is one of the success stories in identifying and doing intervention early on at Gateshead. Next slide, please. So the advice of the chief medical officer is drink no more than 14 units per week. Um, is there much evidence for 14 units? If you remember, it used to be 21 units, and before that 28 units. So it keeps going down. Ideally, I would say less than 10 units per week. The risk is low if you're 14 units, but if you have other risk factors such as diabetes, it just adds up. So be wary of even just the 14 units. The main thing is spreading it out over a few days and have at least 2 to 3 days without any alcohol, especially if they're next to each other. And again, I would recommend checking out the British Liver Trust if you're at risk of alcohol-related liver disease. The simple blood tests we can do to check if you're at risk of significant scarring. That it is available at any GP surgery called ELF or FIB4. And if you're identified as higher risk, then we can do a fibroscan. It'll at least give a good idea. Are you already developing a bit of scarring, in which case you really need to address the risk factor. Even if you're doing to 14 units, you may have to cut down even further. It's a good wake-up call and empowers you to look after your own health. And what I haven't said is some of the protective effects, because it's not just alcohol-related liver disease, but in general for liver disease, coffee is good. So if you're a coffee drinker, a couple of cups of coffee is good. Has protective effect on the fatty liver, especially in Hep C. And also we are seeing in other, although it's not completely proven. And exercise is good. Again, there is good evidence for fatty liver, at least 30 minutes of weight-bearing exercise, moderate exercise for at least 5 days a week. There is good evidence for that. It reduces the fatty liver scores. Next slide, please. So what about, I keep getting asked, but there is the J-shaped curve. You may all remember. Small amounts of alcohol is good for you. And all those initial studies which showed a bit of benefit for moderate alcohol drinking have been mainly cardiovascular. And there is some evidence that it reduces risk, severity of rheumatoid arthritis. But the amount is very small. I'll show in the next few slides. And there is a threshold after which the consumption of alcohol increases health risks. Any guesses as to how much that threshold is?
2 units?
0.75 units. Next slide, please. So that is if you consider daily drinking. So above that, it seems to go up. The risk goes up. So that is about a small, half a glass of wine, basically, or one of these small bottles of beer per day. So in practical terms, it's not feasible, isn't it? So just have that little bit of wine. It's almost like medicine. But there is some evidence, it may have evidence, but it's not, I wouldn't say if somebody is not drinking, oh, have a bit of wine, it'll reduce your risk. I wouldn't say that. I'll explain to you why in the next few slides. Next slide, please. And again, the risk of alcohol and varies in different age groups. Early on, it's mainly sort of injuries and accidents in younger age group related to alcohol excess. And this is the group age 40 to 64, which causes alcohol liver disease and cancers. And then the alcohol has also a risk factor for cardiovascular disease. So after 65, it's mainly cardiovascular disease. Next slide, please. So what we do in practice, we do the audit C, we give the brief advice, brief intervention, and we do a fibroscan. A fibroscan is a non-interventional, like an ultrasound scan. We ping the liver and we check for the reflectivity. The stiffer it is, the more reflective it is. So that indicates scarring of fibrosis. And it is very good, and it's replaced liver biopsies. Previously, we used to biopsy the liver to see if they've got scarring. Now we do fibroscans. It is easy, bedside, takes about 10 to 20 minutes. And it has replaced liver biopsies, and it's changed how we do liver medicine. Because we do, when they come, we do the fibroscans, serial fibroscans, and it's very good for them to be empowered when they do lifestyle changes, and we show a difference in the scarring. And once they develop cirrhosis, they're at risk of cancer, liver cancer, and GI bleeds and decompensation. So we do this at regular intervals. So that's what we do at Gateshead. Next slide, please. This is a WHO fact sheet about risk of alcohol and cancer. Although this is not my topic, I cannot not say this. Any amount of alcohol increases the risk of cancer. And up to 1 in 10 of all cancers causally linked to alcohol, they drank very small amounts, about 60 ml of spirits per day. So, and then the risk of cancer doesn't do this. It just goes up steadily. So any amount can increase your risk. So this is not necessarily related to liver disease. It's other cancers, GI cancers. Next slide, please. So in summary, ARLD is a very modifiable disease. I think it's a recognition when you have fatty liver or when your liver enzymes start go up, and modifying the risks prevents scarring and cirrhosis. Alcohol may have some possible benefits, cardiovascular, diabetes, and rheumatoid arthritis. But WHO is very clear on guidance of cancer risk. And there is a narrow window for safe limit. Unless you put in the numbers and calculate, it's very easy to underestimate your intake. I used to have a slide where patient used to say, I only have a glass, and show me the glass. If you bring the glass is so big. So we tend to underestimate our alcohol intake. So objectively calculate it and do the audit C score. And I recommend to anybody who drinks alcohol, just do this, just to get some awareness. Okay. And I'm not really broached the topic of the benefits of alcohol in terms of social interaction and the role of alcohol in that. And it's not my remit, but potentially the benefits. So I'm not saying stop drinking completely, but there are safe limits, and consider your other risk factors that you can modify. Thank you very much.
Thank you very much, Dr. Alan. So that was really, really helpful.
Thank you. That's amazing. Oh, thank you, guys. Thank you.
We will go into the questions shortly. Before that, we will just talk about. Can you still see my screen, by the way, or?
No, the screen is gone. You stopped sharing.
Let's reshare it in a second. Okay. So before we go into the Q&A, it would be wonderful if you could get your feedback So as you can see, you can share this code on the screen, or you can use the link. But we will also post that link on the WhatsApp chat, so you'll be able to do it on your phone if that's easier for you. We really need to understand what you want from the webinars, and that really allows us to understand the topics as well, and that helps us to find the speakers who will be able to talk to you about what you want to hear. So we are very, very keen to get that feedback. So please use the feedback link or the QR code to tell us exactly what you feel about Ellipsa and our webinars. So you can also join the Ellipsa community. So we have got a WhatsApp group and community that has 217 members or more. It's constantly increasing. I think the number is from maybe 3-4 days ago. So this is spread across the world. As you can see, everywhere in the world, we've got presence of Ellipsa. So if you want to know what Ellipsa is doing, if you want to catch up on our past webinars, read our blogs, ask questions to our speakers, even after the event, for example, then please join our Ellipsa community group on WhatsApp. So these are the links for that. Again, you can either message any of those numbers, or you can click that link, which would also be in the chat, and then you can join the Ellipsa community. We also have a website and a YouTube channel. So any of the previous webinars, we've been running webinars since 2023. So any webinars you have missed, please catch up on those as well. And then finally, we won't actually have a webinar next month, because we are having our annual general meeting. So it will be in December. So when we come back after the general meeting, we will think more about what you want to hear, what the community wants to know from Ellipsa, and then we'll ensure that would happen in 2026. So we're looking forward to this. So this is also reflects Ellipsa's growth from 2 or 3 people trying to make things happen to having an organization behind it. So this is wonderful growth for Ellipsa, but mainly this is all about how Ellipsa can cater to the needs of the community who supports Ellipsa, and you are Ellipsa. So I'll leave the stage for Dr. Abalande to ensure the Q&A is on. I'm sure that we've got plenty of questions for Anand. Thank you so much for the presentations, and let's go for the Q&A now.
Thanks.
Yep. Thanks very much, Doc. We really appreciate your help in presenting this today. So we have a question in the chat box already, and if there's anyone who speak as well, you can always raise your hand and you'll be called at some point. The first question is, would a routine LFT, that is the liver function test, identify fatty liver? That's the question, please.
It's a very good starting point. The liver enzyme test elevation is common in fatty liver. So that would definitely be the starting point. It won't tell us how fatty it is, but that leads to the testing of the FIB4 or ELF testing. And then the GPs will refer for fibroscan. So definitely LFTs as a screening is a good thing.
Yeah, thank you for that. I think we have someone raise their hand. I saw it slightly, but I can't see it again. Did anyone raise their hand? I can't see it
Yes,
again.
it's me.
Yeah. Oh, please go ahead, sir.
Okay. Thank you, Dr. Reddy, for that wonderful presentation. It really captured my interest, and I really appreciate you for that presentation. I have the number one question I have is that this liver problem, can it happen to people that have not been taking alcohol at all?
Thanks, Trevor. So the question is, if you don't drink at all, can you get liver problem? Is that the question? Yeah. Yes, you don't develop alcohol-related liver disease, but if you have diabetes or insulin resistance, you're at risk of fatty liver. And the reason why I said about the global burden of disease, diabetes is going up, is that's the biggest risk factor for fatty liver. And we used to find alcoholic liver disease as the number one, not anymore. It's fatty liver related to alcohol called MASLD, or metabolic associated steatotic liver disease, um, medical terminology for fatty liver. So that is going up. So yes, you can, but only if you have risk factors. Um, and there is also more and more evidence, even people who appear to have normal BMI may have what's called thin on the inside, or may have fat around the visceral organs. And that may be a risk factors for fatty liver. So I feel that we should all have a screening of LFTs at around 40. Unless you have risk factors, you get it done much earlier.
Okay. Okay, thank you very much, sir. My second question, sir.
Yeah.
Sorry for taking the time. My second question is that during the recovery period for the people that are recovering from alcohol effects in the body, have you ever tried any exercise therapy or physical activity therapy on them as a sort of therapy to take them away from that lifestyle?
Yeah.
And is it possible?
Yeah. Thank you. I think that's a very good question, because we looked at it in terms of our group, and I got a medical student to interview all the people who had alcohol excess. And can you guess the commonest reason?
No.
It's boredom.
Oh.
Yeah. And it's because they don't have anything. It maybe starts off with something else, and then they reach to that drink as a comfort. They don't have anything else to do, reach for the drink. So I have supported a couple of people to develop sort of rehabilitation units and the focus is on activity, be it games, table tennis, or not badminton. We didn't have facilities big enough for badminton, but carom or interactive games. So it's not just the physical activity, it is just focusing on something else which they feel is helping them, makes a real difference. But exercise does have benefits on liver in general anyway. So it's doubly good if they can do an exercise program.
Okay, thank you very much, sir. Maybe sometimes I will get your contact, then we'll be able to say thank you, sir.
Thank you.
I think we lost. I can't hear from you again. Do you want to say anything, please? Okay, yeah. Just do we have any other questions? I would like to ask a question as well.
I would like to ask a question if possible,
okay.
please.
Yeah, please go ahead. Yeah.
Yeah. So again, Dr. Reddy, thank you very much. A very interesting presentation. I'm not in the medical field, but I might attend because of my interest in medical inequality.
Yeah.
And listening to your presentation is kind of two things. Well, one thing came to mind, but the linkage to that is that because not all cultures drink, say for, if I say Muslim culture, and with the taboo that comes with that, when somebody is diagnosed with liver problems due to alcoholism, they do not get the same level of sympathy or support, if I say it like that. They're seen as, oh, you got God's punishment. We're human.
Yeah.
The people's perception is, oh, they got it because they're drunks and whatever. It's their punishment, not our problem, kind of thing, if I say it like that. And so what happens with that is that people then don't want to, because people drink for lots, like you mentioned, boredom. People, people with addiction eat for boredom because of food, all the different addictions. I was very fat until recent because I was a food addict, or my Pepsi Max addict, 5 times a day job kind of thing. But because of my religiousness, I did not smoke or drink and all the rest of it. But I know my personality trait is that if I start, I can go into that kind of addiction stage very quickly. Anyway, the main point I'm going to say is the people hide. That's the shame, the stigma that comes with it. People either leave it until the very last minute when they know they have to, when they jaundice basically, and they have to go for support, or they they have no choice basically. So it wasn't so much a question so much, but but with that is the observation that social taboos, shame, stigma, how they're perceived by the greater community if they're from certain communities that don't drink, can be a big barrier to getting support or getting that community support to improve. If I make that observation.
Yeah, I think you're right. I completely agree with that, and I have had experience of that. I've been the vice chair of the BAME ethnic minority uh, group in our hospital, especially during COVID, and we felt it really then, that our patients weren't getting because there were no big. I don't know. I speak for I think all our cultures, but we are all very dependent on our family and our community. We
Totally.
didn't have that during COVID, and we couldn't get people to come and visit them, and so we struggled really to get things like a religious sort of box, for example. We got for Sikhs, for Muslims with Quran and some things, and ability for them to see somebody of the same faith. So I have had some experience, and I do feel that in some communities, it is looked upon as a sin, basically, and you're harming yourself. So they're almost cut off completely. And that is a big shame. And that is a vicious cycle after that. Getting them back
Thank you.
is really difficult. And that's why I said I didn't mention the alcohol effects on the society and sort of socializing and being in part of the community. It works the other way here, where the culture is you're expected to drink. If you don't drink within that group, you're considered abnormal. So it works both ways, and I do feel it's really important that we respect that as a condition. It's not they're not harming themselves willfully, and another person just like me. And the number of patients I've seen, I tell my resident doctors, you see, it could be you with those circumstances affecting you. You could be that in 10 years. So don't label them alcoholic. Don't label them. Just treat them as a person with that problem. And I think that's really important. And I agree with you fully about that.
Yeah, thank you, sir. Do we have anyone who would like to ask any question, please?
Mr. Tunde Falola's hand is raised.
Oh, come, I can't see the hands today. Okay, please, sir, go ahead.
Thank you very much, Doctor, for that beautiful presentation.
Thank you.
It's wonderful. My question, most of the questions I have written before now, you have answered most of them in your presentation. But the one I want to ask, two things. One is, in cigarettes, they always put an indication there, a warning signation, that smokers are liable to die young. Is it not possible or necessary to have the same warning on alcohol drinks or their bottles, so that the only thing they wrote on their advert is that do not sell for anyone under 18 or 16 or something ages, because of the awareness that is necessary to pass across to people? It's not necessary for companies to put those things so that people will be aware what they are going into to avoid these liver problems. I don't know whether you answered that before I ask the second one.
Tunde, I completely agree with you. I think the industry has not behaved in a responsible way. And one of the champions was in the Northeast, called a person called Chris Record, who has done a lot to try and take the industry to task. And one of the first steps where it made a big difference was the minimal pricing, increasing the minimal pricing. And your question was about age and not selling them below the age. Is that right?
Because I noticed they always write, do not sell to people under a particular age. But
Yeah.
the most important thing is that, is there not going to be a regulation? This and this, just like it is in the cigarette department.
Yeah, I think it is in the regulation, because nobody can sell alcohol to under 16. But I think that sadly there are ways around it. But the main thing is sort of minimal pricing. Alcohol advertisement has come down significantly. And I don't know if you've seen some of the Channel 4 adverts about alcohol and cancer. That's pretty powerful. So there's now good education about effects of alcohol, and the worldwide the liver disease is coming down because of alcohol. It's a good thing. But in UK, the trend is the opposite.
Mhm.
All right, so thank you. Do you have another question, sir? Okay. Good, Mr. Ibrahim, please. Please go ahead, sir.
I think you're on mute.
Oh, we can't hear you.
Okay.
Yeah.
Sorry about that. Thank you, everybody. And thank you, Dr. Anad. And my most thanks goes to Alipsa. It is clear that our community, we need an organization like this to champion educating and bringing awareness to all of us at large, irrespective of your background. We also understand that just as Dr. Arnold said earlier on, that when you are lonely, something leads to something. It is true that in our community, Muslim community in particular, there are people who, as a result of falling into different issues, such as problem with their family or lack of work, yes, they gradually get into drinking. And I've witnessed it. Because of stigma, they do open it to the community. And these are people that actually go to weekend religious gathering called Asalatu. But by the time it's the impact is so huge, they are not able to cover it anymore, and the family become ashamed of them, and then they go deeper into this issue. From this point, may I ask you, Dr. Arnold, what quantity of alcohol that actually leads to the kind of disease that affects brain, so to say?
Yeah.
Because I've come across that, and I've seen how people get into that situation, and it's very, very hard for them to come out. In particular, I'm talking about not liver problem in that light, but that leads to mental ill health, that they are not able to manage themselves in any shape or form. That is one question. And the other question is that you did mention when you were saying something that we should all go for a kind of a test, whether or not we drink alcohol. So I would like you to please repeat that. So I'm particularly about Korsakoff disease. I'm sure you are aware of that. Yeah, that in particular, I found that among the clients that I came across. Thank you.
Thanks, Abram. I think I'll answer the amount of alcohol causing liver disease. There are various limits. Different studies show different limits, but it needs to be consistent drinking for years. It's usually 4 years or longer. And it's usually things like up to 40 units per week. That's for liver disease and liver cirrhosis. The effects on the brain is because of what's known as Wernicke and Korsakoff's. It affects the cerebellum, it affects all parts of the body. But Wernicke and Korsakoff's, Wernicke's is because of thiamine deficiency. And it doesn't need to be drinking that much, but they're not focusing on the nutrition. That's the problem. It's simple. We give them all patients who are admitted with who are known to have alcohol excess, we give them thiamine, IV thiamine, and that prevents Wernicke's. And Wernicke's leads to Korsakoff's, which is basically a dementia condition. So it is sad, but it's very preventable just with some thiamine. And maybe our community, that's we do not focus that much on nutrition, and it goes hand in hand, isn't it? Once people become lonely, the nutrition goes down as well. They don't get that nutritious food, and also they keep hiding, and they get most of the calories from the alcohol rather than having food. Sorry, what was the other question?
Well, your recommendation that we should go for a certain test, whether or not we drink alcohol.
Yes. So definitely worth liver enzyme tests or liver function tests, as most people call it, getting it done at age 40. Or if you have any other conditions such as diabetes or raised BMI, getting it done much earlier when you have the conditions. Because, as I said, fatty liver or non-alcoholic fatty liver or metabolic associated steatotic liver disease, various terminologies, but it's related to insulin resistance. And we are seeing it more and more commonly in our communities. And that is going to overtake alcohol in our communities as well. It has in the Western world. So if you have other conditions, raised BMI or obesity or diabetes, it's worth getting the liver function test done.
Thank you very much. One of the things that I love in your presentation is the simplicity of presenting it, avoiding the medical jargon, bearing in mind that not medical students or people that are in health or social care that are attending to you, if there are other people, all they want to know, how did it happen? What does it do to you? And how they can prevent and get help for. So thank you for that approach. Thank you very much. Thank you again.
Thank you.
Thank you. We might have to go slightly above the time a bit. Please bear with us, just because we have a bit of glitch at the initial point, and then the few questions that people would like to ask. Would you be okay with that, please?
Yeah, of course.
All right. Thank you, everyone. Mr. Falola, please go ahead, sir.
Lastly, I just want to find out from doctor if there is anything that makes one not to either drink alcohol whatsoever, even if you have the opportunity and the chance. For instance, when I was in service, I was in charge of West African distilleries, where what they did primarily and purposefully was all these alcoholic drinks, the whiskey, the brandy, and all sorts. But surprisingly, I didn't go near them at all. I don't know. Is there anything that accounts for that outside, both medically or otherwise? Because it's surprising to me, after I left that place for 3 years, after I worked in that factory for 3 years as a resident officer, and I never tasted that drink. So it surprises people when I tell them that. So,
Yeah.
doctor,
I think, Tunde, there's sort of not medical, but I suspect it's to do with your upbringing and your culture, where you probably didn't see alcohol as something you had to do. It's not something you have to, um, um, and uh, and there is most of it is usually due to peer pressure when we're younger, during teenage years. Uh, and then later on is due to sort of boredom and social isolation. So I suspect it's to do with your culture. Um, some people have alcohol dehydrogenase deficiency and they become really unwell even with a small drink. And it's almost like an allergic reaction. But for them, it's probably a blessing in disguise. They can't drink, they become seriously unwell. But I don't think that's you, Tunde.
Thank you very much, Doctor. God bless you.
Yeah, thank you very much. Just a short question that I would like to ask as well. I just wanted to know, I know some of us back home don't really drink alcohol and all that, but we are exposed to some kind of, we could say, concoction, like we call it agbo, yeah. And so I just wanted to know if there is any kind of risk to fermented drinks, or let's say traditional concoction and things like that, if that could pose a kind of risk to alcoholic liver disease as well.
So this fermented drink, there is various in various parts of the world. This is not fermented toddy, is it? It's not.
It's non-alcohol.
It's
Some
non-alcohol.
some of them are prepared with water, but it
Yeah.
takes 5 days, and by the time you see it, you could smell it.
Yeah, yeah.
And
Fermented.
yeah, and some are actually prepared with gin.
Like plantain.
Yeah.
Yeah, so some are like adapor, like you have to mix
With
everything together.
alcohol.
Yeah. So that's why I'm asking that. Some people think they don't really drink alcohol or something, but they still bring all those things together.
Intoxicated.
Yeah, and then they have to drink it. Probably they will have to take it with analgesic and things like that. So if there is any kind of risk to them
So
developing.
in general, fermented drinks are really good as long as it's not very high alcohol content. And I don't think they are. And in India, we used to have a drink called toddy. Alosh might know.
Okay.
From palm trees, and they collect it early in the morning, and it's fermented from the palm tree sap, and that contains low amount of alcohol, but sort of sold as beneficial. But as long as the alcohol content is very low, and it's fermented drink in general is good for you.
Okay. Yeah. Thank you. Thank you. So, Mr. Aturashi, we just have a few minutes left. You can just say something, sir, so that we can. Yeah.
Thank you. I will just say to attendees that we are fortunate to have Alipsa, number one. But if we truly believe that each and every of our communities, it is for us, then I think, in my view, we should introduce people into this to Alipsa, because what you are benefiting from, if others do the same, surely will bring this news to our community, and it is for our betterment. We know that a good health is a wealth that we all deserve.
Yeah.
Thank you very much. Please
Thank you,
introduce Alipsa to others so that they can benefit, whether they are near here or afar off, at least for the sake of humanity. Thank you.
Thank you very much.
Thank you.
Thank you.
Okay. Yeah. Alosh, would it be okay to?
Yeah. Thank you so much for the presentation and all the time you've taken to answer the questions, Dr. Anand. It was great to have you, as we can see from the number of questions that was raised. So this concludes the webinar, but if you have any questions, and I know that few people could not get in join the webinar due to the issues at the start, but if you see this webinar on YouTube or the community channel, please ensure that those questions are noted, and then that is put in the community group, and then hopefully we'll be able to ask those questions to Dr. Anand, and we'll be able to find answers to those as well. So once before we go, again, apologies for the issues at the start, but thank you so much, Dr. Anand, for the presentation and taking your time, going over an extra few minutes. Thank you so much for answering the questions as well. So before we go, I'm just going to play a video just to talk about Ellipsia's recent Congress, but you're free to go as well while that's playing, because it's past 8 o'clock. Thank you so much.
Thank you very much for asking me to join. I think I will probably join your group. Thank you.
Thank you.
Thank you. That's good. That's good.
Thank you very much, everyone. It's good to be here. I really enjoy myself tonight. Thank you.
Thank you, Doctor.
Thank you. Bye.
Except Isle of Wight with a squirrel. That's insane.